Hey, Dr. Derek Nielsen here, the owner of Kaizen Physical Therapy, where we help people who are age 40 years and older who have been dealing with pain for 6 months or longer. We help them get back to being active, mobile, and pain-free without pain meds, injections, and surgery. And today I want to talk about low back pain, kind of the theme lately, and how we must get two things right. We got to get two things correct in order to find a resolution to it. But first, if you're really serious about getting help for your pain and you want to help yourself, I recently authored a book. You can find this for free for download at thepainreliefbook.com. Just head on over there and download it for free. So the two things that we must get right, we must get correct, is number one, we've got to get the diagnosis right. Now you got two diagnoses. Really, you've got a medical diagnosis, and then you've got what we call a physical therapy diagnosis or a movement diagnosis. Now, a lot of times, people come into the clinic and they say, I've been diagnosed with arthritis or degenerative disc disease, herniated discs, and they've got all these things. And then science has shown us time and time again that a lot of the people that have these same findings have no pain. So the question becomes, at what point is the findings that you see on an X-ray and MRI, at what point are they the cause of pain? Now, a lot of times it comes down directly to this, is the cause of pain. If you can point to a specific time when your symptoms started, say like you were in a car accident, or you bent over to pick something up and all of a sudden you heard a pop, and then things started hurting in that direct moment. A lot of times, if that is the cause of your pain, if you can point to a specific time, then what you find on the X-ray and MRI do matter. Let me first say that this isn't necessarily a medical this isn't necessarily for me giving you medical advice. This is what I see in the clinic and what science has shown us. So if you can point to a specific time, then a lot of times that is going to be, the X-ray and MRI do mean something, what they're finding. But the far majority of people that I help that come into the clinic for back pain, they say that they've been diagnosed with these things, but their pain gradually came on. It gradually came on over, the course of months or even possibly years, but they still have these diagnoses. That is the point when we say, okay, the far majority of the time, these aren't the problem. So again, we've got to get the diagnosis right. And you have two of them. You've got a medical diagnosis, and then you've got a movement diagnosis. And a lot of times, the back pain isn't a back problem. It's usually a problem somewhere else within the body. Number two is we've got to get the intervention right. So is the intervention pain meds? Is it surgery? Is it exercise? What's the intervention? Are we just treating the low back, or are we treating the root cause, say the hips or the upper back, that's not moving like it should? What is the intervention? Without the correct diagnosis, the intervention doesn't mean anything. So again, if you want to help yourself, or you want to learn more about why the far majority of people suffer from pain, go on over and download my free book at thepainreliefbook.com. And if you benefited from this, I'd love it if you would share it out. Thanks so much.